Welcome to today's webinar for residential aged care on COVID-19. My name's Brett Morris and I'm the manager of the Centre of Clinical Excellence for Older People at Safer Care Victoria. On behalf of the Department of Health and Human Services, a warm welcome to everyone who's online today and thank you for joining us for today's webinar, which is titled Coronavirus and Supporting Worker Wellbeing in the Aged Care Sector. I'd like to start by acknowledging the traditional owners on the land on which we're meeting and pay my respects to their elders past and present and any Aboriginal elders of other communities who might be listening today. Now, before we start, we've just got a couple of housekeeping items for you. The webinar does include participants external to the department and their views expressed will be that of the presenters. We thank those presenters very much for generously giving their time to speak today. We expect the webinar to run for about 50 minutes, including some dedicated time for questions and answers. You can ask your questions of the presenters through the chat box and we'll do our best to get to as many as we can. Finally, if you're experiencing any technical issues, please contact the Redback Help Desk or type your problem into the chat box. Now, aged care services provide care to people who are vulnerable to adverse impacts of COVID-19. Today is the second in a series of webinars for the aged care sector on COVID-19 conducted by the Department of Health and Human Services. The aged care workforce is key to ensuring older people living in residential aged care receive outstanding care. In today's webinar, we aim to provide you with some clear guidance on how you, the aged care workforce, can look after yourself and keep safe during the COVID-19 pandemic. I'd like to start by introducing Dr. Claire Looker, who is a public health physician with the Department of Health and Human Services. Claire's the Deputy Health Commander for Victoria's COVID-19 response and will provide you with a quick update on the COVID situation here in Victoria.
Thanks very much, Brett, and thank you for everyone who's joined this webinar today and for the opportunity to present. So I was hoping just to provide an update of really where things are at across the state in terms of case numbers, some of the key actions that are happening here at the department in terms of both management of individual cases and outbreaks, but also in terms of sort of strategy going forward. Firstly, as of this morning, the total number of coronavirus cases in Victoria is sitting at 1,036, so that's an increase of 68 from yesterday. As I'm sure many of you have seen in the media, that increasing case number, or the number of new cases, has been relatively stable over the last few days, and which is obviously provides some a little bit of reassurance. However, you know, there's ongoing work to ensure that we're capturing everyone in our current testing criteria, and also that, you know, and obviously that accurately represents what's happening in community. Unfortunately, sadly, we've had 5 people who have died from coronavirus, including a lady in her 70s who passed away overnight in hospital. The age range of patients is right through from young children to the elderly. Obviously, consistent with what's being seen elsewhere, the majority of cases are in older age groups and in those with medical comorbidities. However, we are seeing you know, some mild illness occasionally in children, and certainly some cases in younger adults. Currently, we think there's 57 cases that we can't identify a clear link either with overseas travel or with close contact to someone who's returned from overseas, or another confirmed case. So these are cases that we consider to be sort of indicative of community transmission, and obviously are a focus of a lot of our attention and planning going forward. We currently have 36 people in hospital, which includes 6 patients in intensive care, and over 400 people who've now met our clearance criteria and who we considered classified as recovered and having cleared the virus. It's worth noting that the initial dominance of cases is really in a Melbourne setting, but we're now seeing a number of cases in a number of regions across Victoria. So obviously the pertinence of all this information for the aged care sector across Victoria, not just in urban settings. I'm sure you're also cognizant of the big push that there has been and the different mechanisms that are used to ensure that we're maximising physical distancing across the community. So this is, there's been a number of directives and different powers that have been implemented which require people, for example, to not have mass gatherings, to really limit their movement outside their homes to essential activities. Particularly important, of course, in an aged care setting, but really this is a community-wide push to ensure that we flatten the curve, in inverted commas, as much as possible. I thought one thing that was worth focusing on is the recent change in case definition for coronavirus. So these are the criteria that are developed or that are developed by the department, but in consultation with our interstate colleagues, to determine what we consider a suspected case and therefore appropriate for testing. That is influenced by who we think is at risk for acquisition. So, the obvious groups being people who've been overseas or people who have been in close contact with a confirmed case, but also highlights the groups that we are keen to ensure we capture in our testing because of their interaction with vulnerable groups. So that includes healthcare workers, aged care workers, and aged care residents. So in those groups, and a number of others, but I think they're the ones I wanted to highlight. In those groups, if somebody presents with either fever or respiratory symptoms, the department recommends that individual is tested for COVID-19, and that's then something that's sort of expedited in our system to ensure those results are acted upon as quickly as possible. There's also a very recent change to reflecting the interaction of these groups in sort of high-risk settings to our clearance criteria for healthcare staff and aged care staff who have tested positive to COVID-19. So if you're a healthcare worker or an aged care worker, you test positive, you're obviously required to isolate whilst unwell, and there's a number of clinical criteria that you need to meet before we consider you cleared of the virus. But we're now also introducing a step where there will be swabs, repeat swabs taken at the end of that clearance period to ensure that the virus has been cleared. That's something that we have provided more detail about in our health services guide, and of course our call centre and information line is also across. It's a very recent change, but it will obviously impact on your workforce. But it's the objective behind that is really about making sure that those critical frontline workers in those very important roles in our healthcare service and aged care service, we know that they are safe to return to work. Obviously, our usual broad infection control advice around, hand washing, cough etiquette, and social distancing remains as it was. Broadly across the response, we've had a huge surge in the number of people in the department working on this. We continue to work very closely with individual facilities where there is a suspected or a confirmed case. I would again recommend that the sort of single point of truth for our advice around management of COVID-19 in aged care facilities is through our DHHS website. There is a specific aged care plan, but there is also a health services plan which provides a lot of this detail as well, plus a number of individual sort of fact sheets and resources that will be relevant both to your staff, but residents, families, and others. Thank you.
Thank you very much, Claire, and thank you for taking time out of what's a very busy schedule at the moment. So I'd now like to introduce our next presenter, who's Sue Aitkins. Sue's one of two regional infection control advisors for the Department of Health and Human Services, and Sue supports infection control practitioners working in the Grampians region in health services and in public sector residential aged care. Sue will give us some tips on remaining well and reducing your risk of getting coronavirus.
Hello everyone, thanks for tuning in to listen to this Infection Prevention and Control coronavirus presentation today. Hopefully some of the information you will get will be helpful. Some of it you've heard before, but this is just to confirm that information as well. So let's get started. So how is coronavirus COVID-19 spread? Well, from what we know so far, it is spread person to person by droplets that an infected person coughs or sneezes out. If you're close enough to that person, then those droplets can end up in your eyes, nose or mouth, and you can possibly become infected. Or those droplets are quite heavy, so they might fall onto a surface or equipment that you use. Your hands have contact with that surface or equipment, and then you touch your face. And then again, you may become infected. So this means currently the mode of transmission for coronavirus is contact and droplets. So most of our resources are around contact and droplets. So how do you support your staff to remain well? Well, social distancing we've all heard about, minimising the staff group activities. If you haven't already, think about rotating staff for their breaks, not so many going all at one time. Check the tea room to make sure your chairs are 1.5 metres apart so that they can maintain that physical distancing when they're in the tea room. Do any staff leave the premises to go home for lunch? Because some people live close enough to do it. Ask them to bring their lunch with them so that minimises them going in and out of the facility during the day. Physical distancing, we do know that staff do need to provide care and assistance to the residents, and that's okay, as long as you give them regular reminders to step back to that 1.5 metre distance whenever they can or whenever they're finished doing what they're doing. And sometimes they can interact from that distance. Reinforce, do not come to work if you're not well. Because staff do that. Often, they're worried about working, they don't have sick leave, so have clear instructions on what to do if they feel unwell at work, and they need to, and make sure that they understand this, because it's not a given that they will understand what they need to do, and give them some options if need be. Screening everyone coming into the facility. Don't forget about the contractors and the delivery people that you have. You're still going to need essential repairs done sometimes. So if the toilet breaks and you need someone to come and fix it, or you have deliveries of food in stock. Now these people come at all different times of the day, and sometimes multiple times. So they do come into the building at times. You will have to see what your processes are around this for screening those people as well. Rapid identification and isolation of cases reduces the potential for an outbreak and reduces the risk of COVID-19 infection for everyone. So monitor residents for early signs of illness. When we collect infection data across the board in aged care, we often use a definition for fever because it is not always obvious that residents will have a fever. So the one that we use is from the NIGER definitions of a single temperature greater than 1.1 degrees above baseline from any site can be considered a fever in a resident. Also, we do know of some health services at the moment who are daily temperature checking all of their residents and recording this, so that when those residents become unwell, they have a baseline to work with and they know if they have got a temperature or not. because it is not always obvious. And don't forget about other infections too. They're not in hibernation because COVID's around, they're still there, such as your gastros and your flu and your shingles. We've already had some healthcare workers report shingles. Now, it's not really known what triggers shingles, but it is often stress and when someone is run down. So that will be a lot of staff, and that may even be some of your residents, so do be aware of that. As soon as you have your flu shots, give them to your residents and staff. The sooner the better to reduce the risk of co-infection with COVID-19 or the flu. And we do know a lot of our residents in our region have already been vaccinated and they're starting on the staff now. Reinforce your standard precautions and hand hygiene. So make sure you have enough alcohol-based hand rub around the place. We do know that aged care facilities are often set up in wings and they have one sink per wing. So you may need to have more places where you have the alcohol-based hand rub around so they can get to the sink whenever they can, but have something to use in between. The other thing to think about is residents. Residents need to clean their hands often too, so you may need to check those who can't remember to wash their hands or who are just not going to comply. So check them often. Also, don't forget about those who are not mobile enough to get to a sink and for those who cannot do it themselves. So maybe you need to offer them hand hygiene product and a wipe to do their hands often as well. Providing a reminder on respiratory hygiene, cover your cough and wash your hands afterwards is a good thing, obviously, because of the droplet issue. It's not always possible to have tissues around everywhere either, and so the information about coughing into the inside of your elbow is a good thing to remind people about. Ensure everyone is familiar with your respiratory outbreak process and what is expected for all levels of staff. Oh, I skipped one. I'll go back. Ensure staff. Remind everyone to keep their hands away from their face. That's another one. The other thing is mobile phones. Mobile phones are often at the face, and try to discourage their use during the working activity. Ensure care and support staff know how to put on and remove their PPE safely. From experience, we know this is not done well, and so regular education and reminders are required. The other thing that some of our services are doing is considering a spotter. That is, someone's trained to put on and take off the PPE correctly, and they can every now and then walk around and ask and check and see if staff are doing it properly. Now also ensure everyone is familiar with your respiratory outbreak processes. You may have had regular outbreaks, or you may not have had one for quite some time, and so a refresher is a good thing. Remember, your influenza outbreak kit can be used for COVID-19. Both of those require contact and droplet precautions, and so whatever you have in your kit is going to work for COVID-19. And review your processes by referring to the Respiratory Illness Management and Aged Care Facilities Guideline to ensure your processes are adequate, that you haven't missed anything. Review your cleaning processes. Consider making a list of the frequently touched surfaces in your facilities and develop a cleaning schedule for this. Some examples are like the tablets. A lot of the health services facilities use tablets for patient information and medication administration, so those need to be cleaned regularly. Pages and phones, door handles, handrails that the residents use. So go around and make a list. You'll be surprised at how many there are, and have a regular, frequent cleaning schedule. Don't forget about resident equipment also that staff frequently touch. That's the four-wheelie walkers, the four-wheelie walkers and the transfer hoists, because they get forgotten a bit. And make sure your cleaning schedules are clear and concise and list what needs to be cleaned, how it's to be cleaned, and with what it is to be cleaned with. That is does it just need a detergent, or does it need a detergent and disinfectant? It can be a little confusing for some people. Oh, it's a bit squashed. PPE PPE, personal protective equipment. Now, sequence for putting on and removing PPE is extremely important, and it's something that's not done that well. The reason it's important is to prevent cross-contamination of the user or the environment. Now, often we hear healthcare workers say it doesn't matter how it goes on because it's all clean. Well, that's not quite correct. It does have to go on the right way so it's sealed and that you don't have any gaps. And it also has to come off the right way so you don't contaminate yourself or the environment around you. So consider having laminated posters for putting on and removing PPE. They can be strategically placed in resident care areas or on isolation trolleys if you have them, as a reminder on the correct sequencing. PPE for routine resident care is as per standard precautions during this pandemic. PPE, including surgical masks, are used for residents in contact and droplet isolation for suspected or confirmed COVID-19, and that is the same for influenza. Correct isolation room setup and storage of PPE is essential, and is often a little bit confusing for some people. So the basic rule in setting up your isolation your isolation room and where you put those things is clean on the outside. So anything that's clean stays on the outside of the room. So that's the PPE that you're going to put on, and anything that is dirty stays on the inside of the room. So when you take off your PPE, your waste bins, your linen skips where you put your used linen, they all stay on the inside of the room. Sometimes facilities don't have outbreak trolleys for isolation rooms or for the residents' rooms. So they have a box that sits on the floor with the PPE in, and that puts it at risk because of the aerosols that are generated through walking backwards and forwards in the carpet. So we often recommend a 4-drawer stacker, clear plastic wipeable stacker. The reason we say a 4-drawer stacker is that you can use those 4 drawers to put the PPE in the order that it goes on. So you'd have one drawer with gowns, then masks, then protective eyewear, then gloves. That way they can't get it wrong. They just go from top to bottom and put it on the right way. These are some of the key infection prevention control information in Victoria. You're all aware of these. Read through the website. There's lots and lots of information, and as Claire said, it's regularly updated, and there's lots of information for residents as well as visitors if need be. And good luck with it all. So that's it from me today. Hope it was useful. Thanks for listening.
Thank you very much, Sue. While we've got you there, I might just run a couple of questions that have come through for you. Is there any advice around ducted air conditioning? Frank from Kui Rup was asking.
Ducted air conditioning, not as yet, no. But it's not an airborne thing. It's contact and droplets. So if it has, contact with the environment, and the droplets are heavy and they drop to the floor, so I wouldn't think that they would be picked up and circulated through ducted air conditioning systems at this stage. But maybe that's something that we can get advice on for you.
Yep. Also, if we're vaccinating our residents with flu vax, and they may get a spike in temperature soon after, what would your advice be around then screening for coronavirus?
Take the temperature before you give them the vaccine, and then again the next day they should be okay, hopefully. If not, you've just got to allow for that, yeah.
Within the 24 hours?
Yeah, within the 24-hour period, yep.
Okay. Do you recommend screening staff at the commencement of each shift?
Yes, because they're out in the environment, and most healthcare services have this in place. It's a good thing to do. Everybody comes in the door, basically.
Yep. And I think that's probably... actually, there was a question earlier. I might just run by you to clarify, which was around P95 masks. I'm just finding it.
Yep.
So I was told yesterday that the national stockpile would not release P2 or N95 masks until I had a confirmed case.
Mm-hmm.
They recommended using droplet precaution surgical masks instead. What's the department's position on non-confirmed or suspicious cases as surgical masks are not designed for such activities and we're unable to purchase them anywhere else?
Okay. Well, anyone, even confirmed or suspected cases, it's for care of these people, it's a surgical mask because it's contact and droplet, so surgical mask. The P2N95 is only ever used for those in high-risk areas more often because they're doing high-risk procedures and for any aerosol-generating procedure, which you typically don't do in aged care. However, you may do nebulizers for some people, and if you can move them over to a spacer, that's probably a good thing to start looking at. However, if you can keep your distance and they can do it themselves, then that's okay. But most of the time, you would only ever need a surgical mask anyway. There is going to be a central point for PPE, so I'm not quite sure when what or how it will be released, but I'm assuming that P2N95 will be rationalised for use for those high-risk areas such as ICU, ED, respiratory fever clinics.
Fantastic. Thank you very much. Now, I'll just confirm, hopefully Alison McMillan has joined us by the wonders of technology. Are you there, Alison?
Yes, I'm here.
Excellent. So Alison's the Chief Nursing and Midwifery Officer from the Commonwealth Department of Health, and she's going to give us a bit of an update on accessing PPE for aged care services.
Okay, sorry. I'm sorry to do this, but I wasn't aware that that was what I was doing, but hang on, I'll get my brief.
Or anything else you have to cover in the time as well, Alison.
Okay. I'm sorry, I wasn't aware that that was the topic that I was to cover. I had to do this when there's so many people on the line. Sorry, I'm holding the phone with one hand and working with the other, but is there somebody else on the line from...
Yep. What we might do is we'll jump to Glenn and then we'll come back to you in about 10 minutes.
Okay, thank you.
So I'd like to introduce Glenn Taylor, who's a registered nurse and a CEO of the Nursing and Midwifery Health Program in Victoria. And Glenn will discuss promoting your psychological and emotional wellbeing during the COVID pandemic.
Thank you very much, Brett, and good afternoon, everyone. Thanks for the opportunity to talk today. Really, this opportunity is just identifying to the people gathered today that there's so many things that they can do for themselves, which don't cost any money, and are really and can be quite positive for their health and well-being. So I'm just going to run through a few of these already. So really preparing your day, but being clear that when you get up tomorrow, you know what you're doing. So have a schedule in place. Don't leave the day to chance. And planning promotes your self-control and your self-confidence. So knowing what we're going to do, being directed about what we're going to do, and having some understanding about what we're likely to encounter in the day can be quite powerful and empowering. It's good to get wins early. So if we can establish success first thing in the morning, finding a positive, achieving a win, that might be about, just for some people, it might just be seeing the sunshine. It might be getting their news. It might be having a coffee. It might be embracing their kids. So little things like that can just put people in a really positive mood. And for us to focus on, we're so good at focusing on what we don't have. How about we focus on what we do have? And those things can be really empowering for individuals. Connection is the thing which I think everyone is finding really intriguing at the moment. Certainly we are at our organisation. Is that being isolated and in lockdown from people that we might have contact with on a daily basis is really challenging for a lot of people. Humans need to connect. So whether that be our family, our friends, our mentors if we're at work, supervisors, supporters, our colleagues, neighbours, And like we're doing now, using technology and being creative about the way we do that. And there's lots of stuff going on around out there. As well as those sort of social and collegial people, we also need to ensure that we've got the details about our GP. We have access to our employer's EAP, which most people have access to services such as ours, the Nursing and Midwfery Health Program in Victoria, and other psychological services which can be accessed generally through our GP. And there's lots and lots of online support. We're sort of drowning in that information at the moment. So around government sites, health services, peak bodies, fitness apps, these sorts of things. We really do need to be active. Now, this isn't for everybody, and not everyone has the capacity to be active, but I'm assuming that if we can just get out the front door, we can do a stretch, we can get some fresh air and some sunshine. That can do wonders for our mood, for our physical, emotional and psychological support. Getting up and taking regular breaks, particularly if you're finding that you're confined to space on your days off, for example. Just get up, move, stretch, energise and refresh. And again, there's lots of stuff online which we can use which are really creative, and all of this stuff is free. There's lots of free stuff going around out there. Doing something for someone else. I mean, we're all accustomed to doing this every day, whether we're doing this in our paid employment in the workplace or we're doing it at home in our unpaid work. We're accustomed to this. But these sort of things have been shown to give us joy and satisfaction, which therefore has a positive impact on our own mental and emotional health. So checking on our neighbours, offering a stranger a hand, paying forward a coffee, barter a trade or a task or a good, just displaying a random act of kindness, visiting the Kindness Pandemic Facebook page, which is just exploding at the moment. Just an example, the other day, I bought some lollies for someone who was checking my groceries out, and I instantly felt good about that, and they appreciated it. So little things like that can really be incredibly powerful. How do we seek joy? So, you know, life is throwing us lots of lemons at the moment. We need to try and make some lemonade out of it. So just asking yourself, what's truly important to you? What are your passions? What makes your heart sing? What would you do if you only had 24 hours left on the planet? These sort of things. It can take our focus away from the negative aspects of what's going on in the world at the moment. At the end of the day, we can get a lot of satisfaction about what we've achieved. So just reflecting on our day, and this might only take a few minutes. So asking ourselves what we achieved. What did we learn today? What did I make? Did I make someone's day a little brighter? What was my legacy? What am I grateful for? So identifying just maybe 2 or 3 things that I'm grateful for. And that might be about the fact that I've come home to my children. I can see my partner. I was able to make a difference to that resident's life. These little things, again, can just remind us that we are in a very privileged position, a very important position, very privileged position, and that we actually have an incredible ability to impact on other people's lives as well as our own. It's important to just be always checking in ourselves as well, so about how our health and wellbeing is tracking. And to do this is just a really simple, I hope this can be seen, a really simple continuum. It's called the mental health continuum model. We obviously want to be down the left-hand side, in the green, healthy side. And I do apologise if that's difficult to read, but this information can be Googled. We obviously want to stay away from the right-hand side, the red side, the ill side. So we're concerned about ensuring that our sleep is okay, that our mood is okay, that we're not becoming too grumpy or too agitated or too distracted or too angry. If those sorts of things, which are ideally outside of our regular behaviour, are presenting, then that's an opportunity for us just to stop, reflect, ask ourselves, is there something that we can do about this? And then it might be about engaging a friend, a family member, a colleague, or a professional such as us. This is also a really good opportunity to look out for others, and these are people in our families, in our workplaces, and in our communities. And we really support the Are You OK program. It's online, it's accessible, it's free. There's some really good tip sheets there, and it just gives us an opportunity to learn how to ask that person we might be working with. So it might be a colleague or a family member. Are you okay? And there's some really informative things there about what to look for in those colleagues or friends or family members. And then if they answer with well, no, I'm not actually okay, there's some guidance there on how you can respond in an appropriate and effective way whilst protecting yourself. Mindfulness is something that we do a lot of work with, and it's really taken off. This particular exercise is a real sort of entry-based opportunity just to connect and ground ourselves. And you can do this anywhere, anytime. So just in your mind, as an example, just choose 5 things that you can see and 5 things that you can hear. And just pause for a moment. Think about your immediate surroundings and think about how this can relax your body and calm your mind. And it's proven, it's researched to be beneficial in our lives. And there's lots of apps available, online apps, and they're free. If you'd like more information, you can email me at the end. There's an email link at the end of this. So these are the details. So the Nursing and Midwifery Health Program in Victoria is a state-based, Victorian-based program. That's our telephone number, 94157551, or you can email us at admin@nmhp.org.au, and we've got a pretty terrific website as well. I'll also take this opportunity to let you know that there's a 24/7 telephone support program known as the Nurse and Midwife Support. Again, both of those programs are staffed by nurses and midwives who are experienced in counselling and support and obviously have a wide-ranging knowledge of the industries. We deal with nurses and midwives every single day who are in distress or have challenges with their health and wellbeing. Thank you very much for the opportunity today, and I wish you well.
Thank you very much, Glenn. And I'll just run through a couple of quick questions now that I can answer straight off the bat. People are asking if this is being recorded and will be uploaded on our website. Yes, it will. It'll be on the department's DHHS coronavirus site, and if you scroll down to the bottom, there's an aged care tile, and it will be uploaded on there. There's a few questions around flu vaccine, and the Victorian Department of Health is putting out a fact sheet on the current public health order around flu vax to help you, and it has a series of frequently asked questions, and I think most of the questions there will be covered off in that fact sheet, so it should be up by the end of the week. Now, Alison, if you're there, I might hand over to you and you can continue on.
Okay, sorry, I'm very sorry for the confusion. I had understood I was only speaking about the infection control components of PPE, but that's all right. I'm adapted.
No,
I can talk about the process as well.
That's more than okay.
That's okay. So, my understanding is that the PPE requests for aged care are coming from the National Medical Stockpile, and aged care providers who need PPE must email a particular email address, which is agedcarecovidppe@health.gov.au, and I'm sure this information will be made available to everybody. We're asking people, however, not to contact the primary health networks. Okay. Now, all the requests are being triaged by the Department of Health, and priority is being given to facilities where there has been confirmed cases. So there is a triaging system, and it's important that there are a set of information that we are asking people to provide to us, again, in order to make a request for PPE, and that includes, obviously, the facility, the program requiring the PPE, if you've got a confirmed outbreak or an infectious case, how many staff are impacted, the types of PPE required, and at this moment we're only able to provide surgical masks, and that's what's available from the National Medical Stockpile, and we will ask you to confirm that you have attempted to get PPE from other suppliers as well. We do, and I hope you appreciate that there is a significant demand and a number of emails into this system at the moment, so if you've not had a reply and your matter is urgent, then we suggest you particularly if you have an outbreak or a confirmed case, it's important that you can you re-email to confirm that is the situation. If you've got questions on PPE, then there's again what kind, how do I use it, those types of things. I'll remind everyone. Sorry, is that a question?
No, I think it was just some feedback, Alison.
Okay, all right. So PPE questions can go to aged care COVID liaison@health.gov.au. health.gov.au. And so there is a place where you can form questions, but there is a great deal of material available to you on the health.gov.au website. So I do encourage everyone to go to that website, as it is comprehensive in the amount of information. There is so much information that might find it a little difficult to navigate, but that's principally where we ask you, because that's the most reliable and up-to-date. We're constantly reviewing the evidence. We're constantly looking at what's happening across the world and in Australia, and we continue to update that material. So it's important to keep going back and looking at what we're telling you to do and what the current information is. Is that sufficient to cover for now?
That's fantastic, Alison. And if you could just repeat that email address again.
Okay, so aged care providers requiring PPE must email. I'll repeat it again. This is all one word: aged care COVID PPE at health.gov.au. If you're looking for questions about when do I use it, send those requests to aged care COVID liaison at health.gov.au.
Fantastic. And I would also encourage everyone to get on the Australian Government's Department of Health website and register for their email updates, and they're doing regular aged care specific email updates around COVID as well. Thank you very much, Alison. Sue, I might direct a couple of questions to you if you're still there.
Yes, I am.
Oh, Sue, can I go? Is that okay?
Yeah, thank you, Alison.
Thank you. Apologies again for not being quite as prepared as I'd hoped.
You're fine. Now, I had a question I'm just trying to find around, does a nurse working in an agency in Melbourne who is recruited to the country need to self-isolate for 14 days?
Nurse agency? No, not as far as I know. Not unless they've got meet the criteria in the guideline, as in travelled overseas, had contact with a case, all of those things that are in the criteria.
Yep.
But I would check as they come in.
Yep. And best to your knowledge, Sue, there's no restrictions on people admitting respite residents?
No.
No. Good. Someone's asked, weren't there guidelines to wear N95 masks when caring for a confirmed case? And I think we answered that only if you're doing what do you call it, droplet creating?
Yeah, aerosol generating procedure.
Thank you. Is social distancing necessary for no symptoms and negative COVID-19 test people as well?
Yeah, so everybody should be doing it all the time, just to make sure. You never know.
Now, a number of aged care services are closed to visitors, and so this is from Jess, and she says that we're currently closed to visitors. What are your thoughts about families dropping items off to their loved ones and staff collecting the items at the front door?
If they can be cleaned before they go to the person, okay, but if they can't, I wouldn't be doing it.
Yeah. And we have Marianne, who was asking about home and community care support. What's the recommendations for people over 70? And I think the recommendation is to limit their how much access they're accessing the community as much as possible. Is that your understanding?
Yeah, that's my understanding. Yes, they're in the vulnerable group. Yeah.
Excellent. I think we're... So if a resident is returning from hospital to an aged care service and has no symptoms, should they be screened before returning?
All that information is also in the health services and GP guideline as well, about returning residents. Or is it in one of the guidelines? Can't remember exactly which one. I've read so many. I think it might be in the on the aged care web page.
Yeah, no, I'm
but
sure
there
there's
are
some
guidelines out there exactly on what to do. Yeah.
Yep. So I think the sort of current thinking is around to monitor the person closely, but they don't meet testing criteria if they
that's right.
If they're not symptomatic.
Yeah, exactly. Yeah. Just monitor regularly.
Is a nurse who works away from home all week allowed to go home?
That's up to them. I think that's up to them. Yeah.
There's no.
If they've got no signs and symptoms, they haven't looked after anyone who has COVID-19, then the risk is lower. But then I do know a lot of health care workers are not wanting to go home. So that's something they should discuss with the person they're employed with.
Yep. And I think we've covered off most things. There are a few in there that we haven't got to, but we will follow them up in the frequently asked questions. We'll summarise the questions at the end and put them up with the where the presentation's uploaded, and that will be on the Department of Health and Human Services COVID page. And if you go down to the aged care tile, you'll find it there. So I encourage everyone to stay logged in and complete the room survey at the end of the presentation. It's been recorded and will be uploaded probably next week. Look to the Department of Health and Human Services in Victoria website for current updates and future webinars. We are planning another one. We don't have a date as yet. I'd like to thank all the presenters for their time today, and we're in what's a very busy time for most people who are responding to the current COVID situation, and also thank our staff at Safer Care Victoria and the Department of Health and Human Services who've helped us pull today together. Keep well and look after each other, and we will be back online in the not too distant future. Thank you.